Hello, everybody. Dr. Michael Gaeta here at the Gaeta Institute for Holistic Health Education. I wanted to show you a new study that just came out, which is a nutrition study on selenium and breast cancer. Now, this subject has gotten increasing attention in recent years, and this study is really good, and I want to share it with you today. And because it has immediate relevance to folks, women who have breast cancer or at high breast cancer risk. And so I want to go through this with you. This just came out like a week ago, and actually hasn't come out yet. This is pre-proof, so it was released online, and this is published in Archives of Biochemistry and Biophysics, and it will appear in a few weeks in the journal when it comes out, the December issue. So this is just an abstract. I'll give you the link in the description. Selenium and breast cancer, an update of clinical and epidemiological or population data. And this is a review paper. I kind of like these because it saves you time. They just went to the computer, looked at a bunch of studies, found what was relevant to the subject, and concluded, well, based on the current literature, this is what we would say. And so it's great. They looked at 57 papers in this review paper, and that's pretty cool. So the selenium is an essential trace element, often deficient, especially with thyroid problems, and it is the second most important mineral for the thyroid after iodine. And we look at this paper, and it says, and this is the punchline: clinical and epidemiological or population studies clearly demonstrate, that's unusual that you'll see something that definitive, that selenium status correlates with breast cancer survival. Wow. I mean, that's pretty remarkable. And as a result, one way to curb breast cancer mortality would be via selenium supplementation, especially in patients with severely depleted selenium status. Well, that makes sense because the more depleted you are, the more serious the consequences. And they go on to give you a little summary. Selenium manifests its biological activity through incorporation into selenoproteins such as selenocysteine. However, a better understanding of tissue-specific mechanisms and roles for selenoproteins in general is required. So this is a big deal because breast cancer accounts for about a third of all cancer in women. And this is a simple, nutritional, safe intervention that can benefit women who have been given a diagnosis, but we can kind of go beyond that and say, well, wait a minute. If it helps women who have breast cancer, they live longer, is what this paper said. Then wait, maybe this will help prevent breast cancer in healthy women. That would be my conclusion, right? If it helps the sick patient, since it's a nutrient, it may very well benefit the healthy patient to prevent that sort of problem. And in this case, the breast tissue is very dependent on iodine as well, and selenium, as they're saying here. So they looked at 57 studies to come up with this conclusion. And the idea is that if you supplement with selenium, you can really have a positive benefit. Now, they also highlight the importance of testing, which is true. And the way we test for selenium status, and this really should be done for everybody, is to do a hair analysis or tissue mineral analysis, is how we assess nutritional as well as toxic mineral status. So everybody really should do a hair analysis at least once a year. If everything's great, wait a year. And if it's not great, then do something about it. Work with a practitioner who can interpret that and come up with a plan, and then retest the hair every 3 to 4 months until it's great, and then once a year after that. So that's the best way to check selenium status. Having looked at thousands of hair analyses over the years, I can say with confidence that selenium is one of the most common deficiencies. And this is, I think, underlying a lot of the cancer issues we're seeing because of its role in the immune system and many other functions, and in the thyroid. This is a simple thing to do, is to do a hair analysis. It's inexpensive. And then you find out where what your selenium status is. If you're using a blood test, then you would look at RBC, or erythrocyte, red blood cell selenium. Not so much serum. Serum levels are not great. They're okay, better than nothing, but red blood cell levels of any mineral like RBC zinc, RBC magnesium, RBC selenium, RBC copper, those are always superior to just, serum tests. So the most important, however, is the tissue level, the cellular level of selenium, and we find that out through hair analysis. Now, what do we do about that? Well, based on this new research, what I'm doing in my own practice, if women have a history of breast cancer, are at high risk of breast cancer, currently have breast cancer, I'm adding selenium to their schedule. We're certainly testing, but it is very safe to add selenium to the schedule. Now, dosage is important with everything. And most of the clinical studies on selenium use doses of 200 to 400 micrograms. That's a standard therapeutic dose range for selenium, 200 to 400 micrograms. Most of the clinical studies that show benefit are in that range. So we have a couple of options. We can use a food source low dose formula, and that's called Cataplex E, and that's made by Standard Process. Cataplex E is a low dose formula, so you're not going to get into that clinical trial therapeutic range. But typically, food source minerals like this is a high selenium yeast, are more bioavailable and clinically relevant and effective than more synthetically chelated minerals, in this case, at higher doses. So you can use a low dose food concentrate like Cataplex E, which is a wonderful formula, has many other benefits. Or alternately, if you wanted to get into that typical therapeutic range for selenium, the formula I will use in practice, if I'm not using Cataplex E, is the innate response selenium, which is, has a lot of different foods and herbs in it, and is a 50 micrograms per tablet, meaning total daily dose of 4 to 8 tablets a day. Now, I always try to find foods in the diet that are great sources of particular nutrients. In this case, Brazil nuts are the best source of selenium in the world by far. And so my basic recommendation for the breast cancer patient is, and other folks who are deficient in selenium, like most thyroid patients, is to eat 3 to 4 Brazil nuts a day. And then I'll supplement that with either the Standard Process Cataplex E at a dose of 6 to 9, typically 9 per day, or 4 to 8 of the innate response selenium. And with the Brazil nuts. So if they're going to eat the Brazil nuts 3 or 4 a day, then I'll be on the lower end of the dose range, say 6 of the SP Cataplex E, or 4 of the innate response selenium if you want a higher dose. But I have some patients who are like, I hate Brazil nuts, I'm not eating Brazil nuts. And okay, fine. Then we're going to be on the higher end of the dose range, like 9, even 12 Cataplex E per day. Those are very small tablets, or 8 of the innate response selenium, which will give you 400 mics per day. So the next step is, and I do believe this is something that should be done based on the data, preventatively for women who are at high risk of breast cancer, have a family history of breast cancer, have a history of breast cancer. This should be part of the schedule. And you'll be able to quantify what their needs are based on the hair analysis. And then you track progress every 3 or 4 months. If they have a selenium deficiency, and most of these patients do, it should come up. And then when they become selenium sufficient, then you can lower the dose to a maintenance dose, or maybe possibly they can just maintain on Brazil nuts if they're eating them consistently. So next steps, if you know somebody or are somebody in that breast cancer category, get selenium in there. Secondly, do the hair analysis on everybody. Really, everybody should have this done. And you'll see the links in the chat, in the description, for we have a resource packet that has a lot of information about hair analysis, a hair analysis packet. So use that. If you're a practitioner, you can send in that hair analysis packet letter with your healthcare license, and you'll get 2 free tests. If you are not a practitioner, then we put the link in there, or if you're in New York, which is insane state for lab testing, then we put the link in the description for how to order the hair analysis directly from our clinic, the Gaeta Clinic for Chinese and Functional Medicine. More on this at michaelgaeta.com. And this is a study on breast cancer. I would highly recommend, if you want to really understand cancer and how to prevent it, how to increase cancer resistance naturally, how to support folks who are going through conventional treatments like chemotherapy and radiation. We have a course on this, which is superb, with 9 faculty that address really every aspect of this issue. And that's at cancercourse.com. So you go to cancercourse.com, that's our online course and community. It's a beautiful online curriculum where you get new material on most weeks. And we ongoingly, no end date, we have monthly live classes for new research and to answer your questions if you're in the course. So please go to cancercourse.com and you'll see all the details on that. It's a fabulous course. I mean, it's really helped thousands of people through practitioners who've taken the course and health conscious public who've taken the course. It's really excellent. So that's it. Great study. Really happy about this study, and it's very practical. It's very safe intervention, simple, and enjoy. So again, more courses for the public and practitioners, and our clinic for individualized consultation via phone, video, or live visit at michaelgaeta.com. Thanks for listening. I'm Dr. Michael Gaeta, and have a great day. Take care. Bye-bye.